Welcome, everyone. I'm Dr. Jody Jacobson Fry, the co-chair of the Workplace Suicide Prevention Committee. I want to welcome everyone today to our webinar on creating a puzzle instead of just pieces, 3 recommendations for strategic integration. We're very honored today to have Dr. Linda Langford joining us, Evaluation and Communication Scientist from the Suicide Prevention Resource Center, or SPRC. Next slide. Dr. Langford has been with SPRC since 2006, where she works on strategic planning, communications, and evaluation. She also has helped to develop SPRC's effective prevention model. Next slide. The webinar that we're presenting today is part of the National Guidelines for Workplace Suicide Prevention, which is supported through a collaborative partnership with the American Foundation for Suicide Prevention and United Suicide Survivors International. Next slide. Our goals today are to define strategic integration, to summarize 3 important recommendations, and to enable all of you who are watching to identify at least 1 concrete action step that you can take. Next slide. The national guidelines are founded on 8 guiding principles. Today, we are going to focus on the guiding principle of strategic integration. Next slide. Next slide. Thank you. The national guidelines are also comprised of 9 practices that help us guide in terms of making suicide prevention a health and safety priority. Strategic integration that we're going to talk about today with our recommendations actually spans across all of our practices, from upstream, midstream, to downstream. Next slide. So now turn it over to Dr. Langford, who will guide us through the recommendations. Thank you.
Thank you. Thank you for having me today. So I want to start by acknowledging our funder, the Substance Abuse and Mental Health Services Administration, and to say that the views, opinions, and content in this presentation do not necessarily reflect the views of SAMHSA or HHS. So why is strategic integration important? I'm going to introduce the concept and then provide 3 recommendations. So as Jody said, strategic integration is the first of the 8 guiding principles. And this is the description from the website, which recognizes the unique and necessary role of workplace suicide prevention as part of a public health approach. And here's where I'll focus today. Involves systematically embedding suicide prevention and mental health promotion within health and safety priorities. I'll use SPRC's effective prevention model as a reference point for talking about strategic integration. This model is how we recommend people in all types of settings think through their suicide prevention efforts. So there's 3 components. Strategic planning on the left is the process, how to go about planning. Comprehensive approach on the right is the strategies, your goals and activities. And keys to success in the middle are the guiding principles. Keys to success in the middle are the guiding principles that shape your efforts. So effective prevention is all 3 elements working together. And today I'll talk about just 2 of them. So my first recommendation related to strategic integration is know thy workplace. And that's from the quote, "To know thyself is the beginning of wisdom." So strategic integration has 2 words, strategic and integration. And I'll start with strategic. So to be strategic, planning is key. And so let's take a look at the strategic planning component of effective suicide prevention. So being strategic means using a data-driven planning process. It's starting by understanding how the issues look in your workplace. What are the needs? What resources and assets can you leverage? You'll prioritize which aspects of the problem you'll address first and set goals. It's really important as part of this process to articulate why you want to do something, what you want to accomplish before you focus on what will do to make that change. So the why is in step 2, and you won't choose how you'll make those changes through policies, practices, resources, programs until step 4. This process is also action-oriented. What is likely to make change? What can you sustain? So in short, being strategic is prioritizing and focusing your efforts so they're tailored to your unique situation and context and as likely as possible to be effective. And this is a continuous process where you'll assess results and use those results for improvement. So that's a backdrop for the integration piece of strategic integration. So my second recommendation is to connect your efforts. So the first question is, connect what efforts? And so that's what takes us to the comprehensive approach, or the strategies component of effective suicide prevention. So a comprehensive approach isn't necessarily about sort of checking each box. It's really about combining multiple strategies thoughtfully. And so the focus here is on the goals, or what you want to accomplish. So do you want to increase capacity to identify and assist persons at risk? Do you want to improve the ways that you respond to crisis? So the comprehensive approach is where it can help you really set those goals in step 2 of the strategic planning process. So you can see that these, the possible broad goals or strategies encompass upstream, midstream, and downstream options. And there's a menu of possible activities in each category. There's not one way to increase help seeking. There's not one way to build connectedness. So keeping in mind that you'll probably be pursuing multiple suicide prevention and mental health promotion goals, you want to think about ways to connect suicide prevention and well-being related efforts with your other health and safety efforts. You want to think holistically about all of your efforts to promote a safe and healthy environment where people are able to do their best. So you can ask yourselves, what are the interconnections between reducing exposure to hazards, preventing harassment, building connection, providing access to supports and resources? And there's many different possible ways to connect and make links between these disparate efforts. So you'll just think about what makes sense given the specific strategies you're using for suicide prevention and mental health promotion, and what other health and safety efforts you have. But some examples might be making the links among these issues in trainings or in communications, creating clear expectations and workplace protocols for all of these different situations and issues, collecting resources for multiple issues into one location instead of having employees and supervisors having to search around. So again, those are just some concrete examples, but there's many ways that you can make connections across these efforts. My third recommendation is go beyond implementing training to carry out your mental health promotion and suicide prevention goals, and make sure those efforts are all aligned. So first, go beyond training. So training is often our default activity, and training is okay, but part of strategic integration is really going beyond training to embed what you're training about in some of these other activities. So these are just some examples of other activities, but there's lots more. So again, your exact choice of activities will be guided by your strategic planning process and the goals you prioritized. So why is it important to go beyond training? So in training, we tell people what the institution values and what to do. Ideally, we teach skills and have our participants practice the skills. But what happens in training will have limited effectiveness without other types of efforts. These other efforts help to embed and integrate suicide prevention and mental health promotion into the workplace environment. And they often have more sustainability than training. So if there has to be a pause in training for a time, or there's only certain cycles of training, some of these other kinds of practices and efforts help to sustain what you're working on during those times. So I just said we want more activities than training, but we want to go beyond just having a lot of different activities. So to be effective, these different efforts should be aligned in an intentional way, so they're mutually reinforcing. So again, all of your choice about how to link these and what makes sense to be linking will be guided by your strategic plan. But this alignment will really help to institutionalize what you're trying to accomplish. So you want leadership statements that are aligned with mission and values. Policies and protocols carry out the statements and values. Supervisors are provided with the skills and tools they need to enact the policies and protocols. Benefits and resources are selected in an intentional way and easy to access. Day-to-day interactions reinforce the idea of a caring community. Communications are aligned with training, with policy, practices, resources, and communications also kind of reinforce the ideas of what people can be doing to address and prevent these various health and safety problems, rather than focusing only alone on the problem. Otherwise, you risk having disparate standalone efforts that don't align or may even conflict. And that can make your efforts seem just like lip service, because you're hearing one thing in a training, but that's not really carried out in the rest of the environment. So the National Action Alliance for Suicide Prevention often uses this image to highlight the importance of multiple partners, illustrated by the small fish on the left, joining together to tackle the shark that is suicide. And I think this image is also a great illustration of strategic integration of workplace suicide prevention efforts. So it's really important for, of course, everybody in a workplace to work together strategically to prevent suicide and promote mental health. But it also illustrates the importance of linking disparate efforts related to health, safety, and well-being together. Because alone, each of those individual efforts may have limited impact, but together they can really make a difference. So what can you do with this information? So here's a quick recap of the 3 recommendations. Know thy workplace, connect your efforts, go beyond training, and align your efforts. So before you go back to your day, I would love you to think about what is at least one thing that you can do to increase strategic integration. And if there's more things you can think of, that's great. But what is one tangible way that you could increase strategic integration of your workplace prevention efforts? And with that, I'm going to turn it back over to Jody.
Thank you so much. What an incredible presentation to bring together our micro, our meso, our macro, or our upstream, midstream, and downstream approaches to suicide prevention. And I'm so glad that you called everyone to action, because I'm actually going to offer an opportunity on how you can take action today to begin this path to become more suicide informed. We encourage everybody to go to www.workplacesuicideprevention.com and take a pledge to make suicide prevention a health and safety priority in your workplace or professional organization. Thank you again, Dr. Langford. Thank you everyone who's watching this presentation. We hope you have a wonderful day. Take care.